More than 30% of caregivers report facing financial hardship because of caregiving expenses. Caring for someone can be especially challenging when living on a low income. Some caregivers cut back on their spending or their family's spending or use savings in order to pay for the needs of the person they care for. Those caring for children and older adults at the same time, known as the sandwich generation caregivers, are facing some of the greatest financial hardships. There are some potential financial supports that caregivers may find helpful. A good place to start is the Government of Canada's Benefit Finder tool. The link is in the description box below. Unfortunately, benefits and tax credits for family caregivers are quite limited. The Ontario Caregiver Coalition has identified financial distress as a top advocacy priority, and as of January 2023, lobbying to the Ontario government to make Ontario's caregiver tax credit refundable and provide Ontario caregivers with access to direct funding is underway. Their letter to the Ontario government, along with the Government of Canada's Benefits Finder tool, can be found in the description box below. There are some alternate financial supports caregivers may also wish to pursue. The Assistive Devices Program, or ADP Ontario, helps people with long-term physical disabilities pay for a wide range of equipment, like wheelchairs and hearing aids. The ADP also helps cover the cost of specialized supplies, such as those used with ostomies. They cover 75% of the cost for most equipment and supplies. For these items, they are billed directly by the supplier, and you pay 25% when you buy the item. In some cases, you receive a series of payments throughout the year to help cover the cost of supplies. To qualify, you must be an Ontario resident, have a valid Ontario health card, have a disability requiring the equipment or supplies for 6 months or longer. They do not consider your income. For more information, visit the link in the description box below. The Hardship Fund is funded by the City of Toronto to help pay for certain medically based items or services, such as incontinence products, eyeglasses, emergency dental work, medication, medical items like walkers, hearing aids, hospital beds, and more, or funeral expenses. The eligibility criteria includes persons who live in Toronto with an M postal code, persons who are low income, either from employment or a fixed income, such as Old Age Security or OAS, and Canadian Pension Plan or CPP. You can apply regardless of your immigration status in Canada. However, persons who receive OW or ODSP are not eligible and instead should contact their caseworker about how to apply for funding for medical supplies. How to apply for the Hardship Fund. Collect your and your household's birth certificates, health cards, SIN cards, rental lease agreement, and bank statements from the last 3 months. Obtain an official quote estimate for the cost of the medical supplies from a supplier. For many items, you will need documentation from a physician that confirms the necessity of the medical supplies. For example, if you are applying for funding for incontinence products, the physician can write a letter indicating that the person experiences incontinence and requires incontinence products like diapers, pads, wipes. This letter should also refer to the quote estimate of the products. Once these documents in original have been collected, you may phone the Hardship Fund to apply at 416-338-8888. They recommend that you do not pay for any items or services in advance, as they can't guarantee you will be reimbursed if you've already paid. For more information, visit the link in the description box below. The City of Toronto's Homemakers and Nurses Services, or HMNS, provides subsidized homemaking services to Toronto residents who have limited financial resources. Considerably more affordable than paying privately, HMNS provides support with light housekeeping, laundry, shopping, and meal preparation. The intake caseworker at 416-392-8579 will explain the program and requirements for eligibility. For more information, visit the link in the description box below. Ceridian Cares is a charity that provides grants to Canadian residents who are low income and in need of financial assistance for items such as clothing, footwear, food, basic household needs, medical needs, or assistive devices. Financial grants typically range from $200 to $4,000, up to a maximum of $5,000. Once you apply, you can expect a response within 90 days. You will be required to submit the recipient's Canadian birth certificate or permanent residence card, most recent year's Canada Revenue Agency, or CRA, Notice of Assessment. Be sure to include the Notice of Assessment for all income earners in the household. 2 quotes or estimates from vendors or service providers for the cost of the items for which the financial assistance is being requested. Letter from a third party, like a doctor, social worker, or therapist. Tips on completing the application. As part of the application, you will be asked to describe what you hope to use the financial grant for and how your family will benefit. It is recommended you be very descriptive about the need your family is experiencing, so reviewers have a clear understanding of your situation and how much of a difference the grant will make. You will be asked to submit 2 quotes or estimates to demonstrate the need for financial assistance. This could include receipts of past prescriptions for medications, while indicating how often this will need to be paid for. For example, clearly write out how much is spent on this medication each year. This could also include attaching an online shopping cart from your store of choice. It is important to include all items that the money could be used for, like vitamins, food, meal supplements, incontinence products, clothing, cleaning supplies, or assistive devices such as a shower seat. This quote will help determine how much you receive as a grant. For more information, visit the link in the description box below. March of Dimes Home and Vehicle Modification Program, or HVMP, is available to permanent residents of Ontario who live with a substantial disability that impacts their mobility and daily function, and who can't afford the modifications they need to maximize their independence. Anyone who qualifies can apply for up to $15,000, the lifetime maximum, for home modifications, and or up to $15,000 every 10 years for vehicle modifications. There is an applicant assessment guide to help walk you through filling out the assessment form for the program. If you have any questions, this interactive guide may have the answers. For more information, visit the link in the description box below. Hilarity for Charity, known as HFC, awards home care respite grants to those providing care to their loved ones who are living at home with Alzheimer's disease or other dementias. The goal of the home care grant is to provide exceptional home care to families affected by this disease and to give these families support and rest. These grants are facilitated by Home Instead Senior Care. These grants are for respite care hours. There is no cash value. When applying, there are 2 possible grants available to choose from. The Recharge Respite Grant is a one-time grant of 50 hours of respite care to be used within 3 months of being granted. The Extended Relief Respite Grant is a 6-month grant of 25 hours of respite care per week for 6 months, or 24 weeks. To be eligible for the Recharge Relief Grant or the Extended Relief Respite Grant, the caregivers or loved one living with Alzheimer's and dementia must fit within the following criteria. Currently living at home with Alzheimer's disease or related dementia. Caregiver is facing financial and emotional hardships due to the unique challenges of Alzheimer's or related dementia. Resides in the United States or Canada. Tip for completing the application. It is recommended to be very descriptive about the need your family is experiencing so the reviewers will understand how much of an important difference the grant will make to you and your care recipient. For more information, visit the link in the description box below. The Alzheimer's Society of Toronto has run a caregiver project for grants to help support caregivers and their care recipients living in Toronto. To apply for the caregiver project, call the Alzheimer's Society of Toronto intake at 416-322-6560 to book an appointment. For more information, visit the link in the description box below. Flash funding or crowdsourced donations can be an option for people comfortable setting up a GoFundMe to raise money for a specific situation or cause. For people in need that don't have the capacity or are uncomfortable with creating a GoFundMe fundraising page, Together Rising supports women, families, and children in times of crisis by providing one-time grants of funds or goods. For more information, visit the link in the description box below. Similarly, Resource Movement operates an opt-in email list, the Rapid Response Support List, which connects list recipients with time-sensitive asks for support from social justice organizers and members of marginalized communities. How to submit a request. Email Rapid Response at resourcemovement.org to let them know you have a request for support. They have found historically that answering these questions helps the success of your request. Who would be receiving this support? What is this support needed for? What and how much support is needed, financial or otherwise? What is the deadline for receiving this support? How can people contribute? What is the email or password for e-transfers or the donation link? For more information, visit the link in the description box below. Please note, the grants and financial supports outlined in this video can be challenging to come by, often with eligibility requirements, lengthy waitlists, and application forms that need to be completed. It can feel overwhelming to try to pursue these resources, so enlisting the help of a social worker, care navigator, or case manager can be useful in completing applications. Your social worker may also be able to connect you with other financial supports or know of grants as they become available. For example, through the COVID-19 pandemic, Flemington Health Centra's East effort has provided grocery gift cards to families in need. For more information, visit the link in the description box below. It can be worthwhile to request a subsidy assessment for any services or programs that do have a fee. If eligible, you could receive a subsidy on a sliding scale in accordance with your financial situation. Beyond help with financial support, social workers with programs like Wood Green's Caregiver Support and Wellness Program offer free one-to-one counseling and facilitate caregiver support groups. If you feel anxious or inundated by your caregiving responsibilities, you're not alone. We all face challenges on our caregiving journey. It's normal. Connecting to a social worker or support group can help. To help navigate these and similar caregiver resources, visit the East Toronto Health Partners Service Directory. The link can be found in the description box below this video. For more information on navigating the healthcare system for your care recipient, watch our other navigation guide videos.